in your body, then that's actually gonna lead to your death because some microbes help our survival. Especially one of your which organ system in your body, the nervous system, the respiratory system, the digestive system, the reproductive system, which of all the systems is a best friend with microbes? Yeah, your digestive system. They even help in your digestion and they fight off any other types of bacteria who are pathogenic, who have the potential of attacking and harming your digestive system. So the human body exists in a state of dynamic equilibrium with microorganisms, and a healthy individual maintain a balanced coexistence with them. But on occasion, the balance is disrupted, allowing microorganisms to cause an infection or disease. So, not every single microbe out there is pathogenic. So we have microbes that are patho means disease, pathology, pathophysiology, meaning involving disease. Pathogenic, meaning that they will absolutely cause disease, and those are parasitic. Parasitic. That's a harmful relationship. And sometimes there are the you have to write that down and take a photo and submit it in the end. Please make sure you don't skip. Non-pathogenic bacteria and those non-pathogenic microbes, those are the ones that are friendly, mutualistic, meaning everybody's happy. Like they're living and eating the remnants of our digestive system and the toxic waste, and we are happy because they remove us to flush all the microbes and toxic waste, defend our immune system, and that sort of thing. Okay, people like that too. There's some people in your life, they're mutual. Both of you are winning. You're benefiting them, they're benefiting you. And some people are parasites, they're harming you more than they are benefiting you. To some people, you are a parasite, you're harming them more than you're, yeah. What is that word mutualistic. Okay. Mutualistic. Okay. Microbes can engage in mutual or commensal associations with human beings. And they belong to the normal resident microbiota. What's a microbiota? That is the biosphere in which these helpful and mutualistic that have a community, that's why we call it communalism, this commensalism, like making a community of interrelations that are beneficial. But when you talk about an infection, well, that's a problem because an infection is a condition in which pathogenic microbes penetrate host defenses and they enter the tissues and then they multiply. So now we remember that microbes, actually pathogenic microbes, and when I say microbes, I don't only mean bacteria. I mean bacteria, fungi, or fungi, parasites like worms, and viruses. Those attack, number one, the cell. And what do they cause? They cause cell injury. So now the cell has been injured. When the cell has been injured, this cell injury now progresses into cell death. Cell death. And when the cell dies, there is a really good, helpful route. It's green. You know the traffic light. Green means good, go. Red means stop. So if the cell dies by a normal, healthy, positive, good way, what do we call that? That is called apoptosis. Apoptosis. And then we will regenerate and make new tissue. But usually, if you're going down the direction of harm, when things are getting worse, things are exacerbated, becoming worse than before. So you have cell injury, then you have cell death, and after cell death, what do you have? Necrosis. So necrosis is the opposite of apoptosis. So necrosis is harmful, damaging cell death. So now, if you look under the microscope, you look at a cell that has died through apoptosis and a cell that died through necrosis. Are they going to look the same? No. Absolutely not. One of them, who can describe for me what a cell that died by apoptosis is going to look like? Let's say that this is the normal cell. If it died by apoptosis, how is it going to look afterwards? No, that's necrosis. Pus is necrosis. If you're sure about your answer, please raise your hand. How do you think apoptotic? Because remember, pus means that there's a problem. But apoptosis means you died in a healthy way. That's programmed cell death. Apoptosis is programmed cell death. Programmed cell death. Are we clear? You have programmed cell death, and the programmed cell death is going to be a healthy, non-disease related. So the cell is going to become into small bubbles known as blebs. They're going to be known as blebs. Circles and blebs. Circles, little circles and blebs that are edible. Edible blebs. Edible blebs. Those are edible blebs. But when there is necrosis, what happens? So in necrosis, the plasma membrane fragments, and when the plasma membrane fragments, you will have a spill of lysosomal enzymes. Okay. Keep playing on the computer, on the laptop, and keep playing on the phone so that immediately after the lecture, I say turn them off immediately. Then I'm going to shut down the portal. So if you're planning on copying from somebody, you're not going to get a chance. This should be happening concurrently as the lecture is going on. So we have plasma membrane fragments. So the plasma membrane used to, you cover everything within the cell. The lysosomes are in here. But when the plasma membrane breaks off, you have all the enzymes leaking out. Imagine there was a power plant factory right by the school. And then there's a spill. A nuclear power plant is a spill. Don't you think that all of this toxic waste, this harmful, dangerous chemical is going to burn everything that's around it? That's exactly what necrosis is. Necrosis is when you break off the membrane of the cell due to the damage. So that means when a cell undergoes necrosis, that means there was a severe form of damage. It means that the cell has been harmed beyond, it has been damaged beyond salvage. So we call necrosis as damage beyond salvage. Damage beyond salvage. That means you have reached the point of no return. Yes?
Another question. In the case of necrosis, this dead cell can move it because like when somebody has like a necrosis, let's say in the finger, that's why they recommend fast. Walking.
Instead of walking?
Yes.
So
like when they ask you, say, like the patient with necrosis, so this cell death is like it's better.
So, so that's the difference. when they do an amputation, it's because of a gangrene. That means bacteria love this kind of dead cell tissue. They love this kind of really ghetto, like really bad place, and then they go and they live in it. Yeah, that's like a ghetto harmed tissue. So some bacteria go and they live on it. When they live on it, that's why we amputate. So dead tissue is going to be like a magnet. It's going to magnet and bring in a lot of harmful bacteria, and the bacteria keep going up because it is dead. It doesn't fight back. Living tissue can fight back. The immune system is going to be able to fight back the bacteria. But a tissue that has been damaged beyond salvage is like a haunted house. It's like a bad house where all the drug addicts and crackheads always go inside it. So the bacteria is like that. They go.
So it's a tissue, it's the necrosis.
Yes.
The necrosis is basically it's the bacteria, it's eating itself, it's eating the own cells.
The cell was used to live there. It was a healthy cell. Now, due to an infection, the bacteria died. So now the home is not clean. There is no electricity. So now the cell doesn't have lysosome. It doesn't have all of the living signs. So now the bacteria love that kind of tissue. So they superimpose and live in it. And now they start to eat that dead tissue and they start moving up, moving up. So that's why an amputation happens.
So you have to cut that part all the way where it is in order to have the new growth.
Absolutely. You have to ensure that because that bacteria that colonized on a dead tissue, that is the one that's hardest, most resistant, the hardest to treat. So you just amputate the entire leg. But hold on, necrosis is the cell level. That's tissue level. We're talking about the whole tissue now. So you have the cell that has been damaged. There's a plasma membrane with fragment and the spill of all of the lysosomal enzymes, the acid, the metalloproteinases, the degradative enzymes, and now those used to damage the invading microbes, now they are destroying their own tissue. So now the spill of lysosomal enzymes is going to cause a damage and a further defect and an inflammation. There's going to be a state of inflammation known as acute. So the first acute inflammation, meaning it just started, it just began. So the spill of lysosomal enzymes cause acute inflammation that comes with redness, that comes with heat, that comes with pain, that comes with swelling, and it comes with loss of function. That comes with loss of function. Inflammation, acute redness, heat, pain, swelling, and loss of function. Yes?
If the person does not do the amputation, it would just basically spread more of the bacteria.
Absolutely. There was a homeless lady that didn't have insurance, health insurance. So when she went to the hospital, they didn't want to treat her. So they sent her back to the streets again. And when they did a interview with her, she showed her leg, and the gangrene keeps going up and up and up. And they don't want to, because now Trump shut down the health insurance for all the people. So now you really cannot get the medication. So you see the gangrene is moving up. She was on the news. If you watch the news, it's important. Before you go to sleep, watch the news. Find out what's happening around you. It may affect you. Yeah.
I think it was like 2 years ago, somebody had like a sore, like an open sore, and it went to and they had an open sore and it went to the beach and swim and they ended up with necrosis.
No, that's different. So that's like a portal of entry.
Yeah.
So somebody that got a tattoo or somebody that had a sore. So a sore is like an inlet. So this inlet is a portal of entry. You go to the beach, you go to anywhere where there's pollution, and you see that the bacteria is going to find the entry site into your body. And then that's going to cause like a defect, necrosis of the tissue, and then gangrene and all that kind of stuff.
You have to go up the whole day.
Yeah, so it happens because it depends on what kind of bacteria. Some bacteria are very resistant. They resist your immune system. They even resist medication. So they end up destroying the whole organ. Pathogen. So the microbe is acting as an infectious agent, and infectious disease is a disease that has been caused by this infectious pathogen destroying the by the infectious pathogen destroying the tissue that colonized by the bacteria. So if you look here, you see we have a contact, colonization, infection, and disease progress. So microbes adhere to the exposed body surfaces. So they first adhere to the surface, like through your nose. For example, you're breathing, it's the flu season, and then the infectious bacteria or the viruses contact and enter through your nares, through the vestibules, through the portal of entry, and then they colonize in there. Obviously, your body fights back because the mucosa, the nasal mucosa, is rich in lymphocytes. These are lymphocytes. These are known as malt. Malt. M-A-L-T. What is M-A-L-T? Malt is mucosa associated lymphatic or lymphoid tissue. And those are your classmate was talking to me about this before the lecture, and that is the T cells and the B cells who are resident sentinel. They're like border patrol, border protection to make sure that if any bacteria comes through, they fight it and they deter it. Then some bacteria is stronger or more overwhelmingly strong against your immune system and the malt, so they end up colonizing in the nose. And then we move on into an invasion phase where the microbes cross the lines of the defense and they enter the sterile tissue. Then we have an infection. So the infection now begins with the pathogenic microbes multiplying in the tissues of your respiratory system. And then the defenses hold the pathogens in check. So there's a fight between your immune system where there is an attempt to balance and repair the damaged tissue. And the effects of the microbes, if microbes are stronger, the pathogenic microbes are more powerful, then they're going to result in the injury and disrupting the tissue, and that increases the morbidity and the mortality. Okay, there's a carrier state. Now you are living with this lingering infection that's happening on, and the microbes are going to be established in the tissue, but the disease is not yet apparent. Eventually, you're going to be carrier for this microbe, but that may spread to, like through aerosol infection to someone who's close to you, and eventually the microbial attack has to be overcome with your immune system. If the microbial attack keeps on the inflammation, and we move on from an acute inflammation to chronic inflammation. If we go from acute inflammation to chronic inflammation, then that is going to take a longer duration. And now your immune system is going to reach a state of exhaustion. So your immune system is exhausted, and your cardiovascular system, which works very closely to your immune system, because who's delivering the white blood cells, the defense? Who's delivering the lymphocytes to the tissue where there is a microbial pathogenic infection? It's your cardiovascular system. And then the cardiovascular system is going to become in a state of shock. So this is known as septic shock. So septic shock is a state of prolonged vasodilation of the blood vessels. So the blood vessels are so wide. Why are the blood vessels in a state of inflammation be very wide? So why are they inflamed and wide? Why not inflamed and tight? Why are they inflamed and dilated? because they need to accommodate a lot of, they need to carry a lot of white blood cells. If an area has an infection, that area will be so red because a lot of blood is rushing to it. We want to bring in a lot of white blood cells so the white blood cells can fight off the infection. That's why an infected area is more red, because a lot of blood is going there with a lot of white blood cells to fight this infection. But this state of very wide, dilated, hyperdilated blood vessel, how does that affect the cardiac output? How does that affect the cardiac output? How does that affect the blood pressure? How does that affect the heart rate? Because you know, your heart is pumping very hard for too long. Ever since you had acute inflammation that progressed to become chronic inflammation, your heart has been severely pumping blood and through very wide blood vessels. So if you have very wide blood vessels, that causes the cardiac output to drop, the blood pressure to drop, the heart rate to drop. If you have a water hose and you tighten it, you tighten the exit, you see the water pressure very high. But if you make the outlet very wide, you'll find that the water pressure dropping. So same thing, your blood pressure drops and keeps dropping. So if you don't cure this infection quickly, and this infection moves on from an acute phase to a chronic phase, and the blood vessels are hyperdilated, your blood pressure is going to keep plummeting and falling down and dropping and dropping and dropping until you will end up with a state of shock. So that shock is a hypotension, dropping blood pressure that leads to death, but it's because the blood vessels has been vasodilated for so long because of a lingering, a continuing infection that is chronic and never ending. Is that clear? Okay, so the resident microbiota, we find them in the internal organs, and their habitats are the tissue and the fluids. Okay, so if you look at a baby that has just been born, the baby used to live in the womb of the mom that was immaculate, 100% clean from any bacteria. Not a single cell of bacteria is there. Then the baby is now born in a world that is full of bacteria in the air, that is full of pollutants, that is full of microbes. So you know the very first few days of the baby are usually very challenging because now the immune system is beginning to develop immunity and memory to fight and combat, learn how to fight all of these different invading pathogenic microbes. Okay, most areas of the body in contact with the outside environment, they harbor resident microbes. We talked about that, the MALT, that's the MALT, mucosa-associated lymphoid tissue. So you know, your nose, air enters through your nose. Your oral cavity, air enters through your oral cavity, and your ears, that's another inlet, okay? And your rectal canal, your genitalia. All of these points are portals of entry. So there is a lot of border patrol. Where is the border patrol usually found? At the borders, where there is an entry site in the airport, where the airplane lands. In by the ports, by the docks, where a lot of ships would come. There's a lot of police there to regulate who's coming in and who's going out. Same thing, your body is like that. So everywhere where there's a potential entry site for these invading pathogenic microbes, you see that there is a lot of policing. There's a lot of white blood cells who are there. Resident, sentinel, resident, sentinel, white blood cell whose job, they're like a police precinct. They're sitting in there to fight the bacteria. So microbes occupy the body for only short periods. Those are known as transient microbes. Resident microbes, from the name, they become established and they colonize there and they make your body their home, particularly your digestive system. So now let's examine the resident microbiota. These are the human, we're examining the human being a home and a habitat for different microbes. For example, the skin and its contiguous mucous membrane. That's the port of entry. All of these sebaceous glands and the hair cells and the follicles, they are a site from which the invading pathogenic microbes enter. Also, your upper and lower respiratory tract, your oral cavity, we said, the pharynx, the larynx, and then the lower respiratory tract also, your trachea up down to the bronchioles, your gastrointestinal tract, that's the home where they all survive. The mouth, the colon, the rectum, and the rectal canal and the anus. The outer opening of the genitalia for men and women, and that is the urethra, the male urethra, the female urethra, and the external genitalia, the vaginal tract, the ear, the external ear and the ear canal, and the external eyelids. So those are all habitats and homes where the bacteria and the different microbes would colonize. Now, if we look at the okay, so the origins of the resident microbiota, they are generally stable, but they fluctuate with general health, age, diet, hygiene, hormones, and the drug therapy. So these are factors that affect the overall state of the microbiota. So that's why they say take your probiotics. So in many cases, the microbiota benefits the host by preventing overgrowth of harmful microbes. This concept of microbial antagonism. What is microbial antagonism? These microbes, they don't like each other. Remember we talked about that. Who can give me an example of how microbes were used against each other? Trump is trying to do this. Trump is trying to take some illegal aliens to make them fight other illegal aliens who want to come into the US. They got that from biology because actually that's true. This is known as microbial antagonism. You remember I talked to you about poultices? What happens in poultices? Yeah, so we use the molded bread, but who's fighting who? When you put the molded bread on a superimposed on a infected laceration or a contusion, yeah. Excellent, excellent. The mold is going to secrete an antibiotic that will kill the bacteria. So using them against each other. That is microbial antagonism. In your digestive system, we have this concept of microbial antagonism because they reside there. If any other bacteria tries to come in to your digestive system, they say, no, we belong here. We're not going to give our space for you. So they fight them. And actually, we're winning because we're not harmed by them. We're harmed by the new bacteria trying to come in. So they defend us. This microbe are defending us, but they're not defending us for no reason. They're defending us because they're occupying our digestive tract. Okay. Endogenous infection. Those are called opportunistic infections. What an opportunity. Occur when normal flora is introduced to a site that was previously sterile. So, for example, you have the bacteria, the deal we have with them, we have a contract with them. You can live in our digestive tract and eat all the food that we eat with us. We have a meal, a big beef burger with cheese. You eat it, they share too. But the price you have to pay is you fight any other bacteria who wants to come in. And if there is any site open, you don't go where you're not supposed to belong. You only stay where? In the digestive tract. But they're very curious. Sometimes if there is an opportunity to make it to the bloodstream, they want to take a cruise. So now that's a problem. It happens a lot where bacteria don't belong anywhere except your digestive tract. They leak and they get an opportunity. That's called the endogenous infection. It's not exogenous. They come from outside, they come through your nose, and now you're coughing. It's what's already inside, and now they go to where they don't belong. And that's endogenous, opportunistic. They took an opportunity. They capitalized on an opportunity, and they leak to go to the blood. The blood is supposed to be sterile, clean, 100%, not a single bacteria.
So if you have a leak in your digestive tract,
When there is an ulceration, a fissure, that type of, yeah. Hmm? Yeah, something internal hemorrhage, GI bleeding, H. pylori. A friend of mine, he's I don't know what's wrong with him, but he doesn't believe that, he said he want to be natural. So he had a H. pylori. And we did the urea breath test, and there is a lot of H. pylori in his stomach. And I told him, if you don't get it treated, you do triple therapy. And the quadruple therapy, this bacteria, the drill that the one that goes through the wall, it can drill through your stomach, and the acid will spill over to your peritoneum. And I told him they even make cancer. H. pylori in your stomach can cause cancer. And no, you didn't listen. And I'm worried now, but it's okay. You have to respect the patient's will, but that's dangerous. You always got to test for H. pylori and follow up with your GI and go to them, go to their office. They have nothing better to do. Go to them and get your GI tested. You don't want any opportunistic infection because once they bore through your stomach, it's too late now. When the fissure took place, there's an ulceration, when there's a fissure, then now it's too late now. You want to go to the doctor now. The doctor can't help you now. It's too late at this point. So all internal tissues and organs are sterile. That shows you the sterile, microbe-free anatomical sites and fluids. That is the heart and the circulatory system, the liver, the kidneys and the bladder, the lungs, the brain and the spinal cord, the muscles, the bones. Those are all tissues and organs that are sterile. Now, if you look at fluids that are also sterile, your blood is sterile. Your urine is sterile. And what makes it even extra sterile is this toxic, burning, acidic, and urea substance while it's leaving your body for the man through the penile tract is going to burn any bacteria that is in that route. And also the urethra, for the female urethra, the urine is going to burn any bacteria that colonized or was taken from the outside, potential urinary tract infection. So the initial colonization of fetus in a newborn, we talked about that. The baby is in big trouble. The baby was in the heaven. It was in a sterile environment. There was no bacteria. Now the baby comes out to the real world, which is like a hell. It's all different types of bacteria entering into the body with the first breath. So the first few days, the baby's getting sick. And the first year to a year and a half, the baby is constantly becoming ill late at night, which is very good. Why is that? Because now the immune system is becoming stronger. That baby is never again going to get sick after that first year and a half, unless they go live in like some really infectious, infested places in the world. If you go to like a place that is dangerous, or maybe there was like a seasonal infection, something that is like that. But they're not gonna have a disease because they're now in a polluted atmosphere. So now when the baby gets sick, the baby is actually becoming not weaker, they're becoming stronger. And these moms and grandmoms, they believe that just give the baby food. When you're sick, you need food. That's not true. They think that when you're sick, you need energy and you need food, and they keep giving the baby food and giving the baby food, and that actually doesn't solve the situation. The baby just now needs stabilization. Don't deprive the baby from the food poverty, but you just have to give them a stable diet. But people think when you're sick, you need food, right? That's true? Yeah, they think. You have to eat. You need energy. I was very fat, and then my grandma gives me food. You need energy. I have all the energy. No, you need energy, and she just gave me a lot of food until I became like until I did my surgery. I was like a sumo wrestler before before I get hired here. Anyways, so the uterus and its contents are normally sterile. And then when there's an exposure to during the birth, actually both are in danger, in trouble. The mom and the baby. Because when the baby is coming out, there's ulcerations and fissuring that allows for the bacteria in the air to enter even into the mom's circulatory system. And many moms died in labor in the past because before they learn about the microorganisms, back in the day when they used to think that life happens at the naked eye level, the gross microbiology, the macrobiology, gross biology, or macrobiology. So you would have a doctor that would be working in the morgue and working in with the dead bodies and cadavers, and the mom is giving birth. He wouldn't even wash his hands. They would just come and then they would infect the mom, and the mom would die. And they never knew what's the cause because remember, back in the day, they had no idea there's bacteria. They just, yeah. Yeah, they thought that the only thing that can hurt you was something you see like a snake or a scorpion, and he looked, there's no snake or scorpion on me, but he didn't know there's a lot of bacteria that was taken from this dead body. And so, yeah, so many moms died. So subsequent handling and feeding of the newborn continues to introduce what will be the normal flora. So what are the sources of normal flora? Would be the breast milk, the colostrum, that's going to give the baby energy and give it immunoglobulin from the mom, and also give the baby some positive normal flora. That's why it's very good for the mom to give the baby breast milk. And if you can't give the baby breast milk, you can give to the other mom who gives breast milk. You know that? You don't do that here? So you can give your baby breast milk, and if you don't have a lot of breast milk, you give your baby to another mom. Some women. I don't know if they do this here, but in other parts of the world, they give. Okay. If you're against it, it's okay. This is what's happening in the world. So, yeah. Okay. Yeah, you give your baby. There are nursing moms that they do this for a living. You pay them money, and then they breastfeed your baby, and actually the babies become very healthy because they're getting the mom's milk, and then they're getting the.
You know what I think that just give your baby to somebody. You know what I'm saying? Like I'm breastfeeding and she's breastfeeding and I don't have.
That's what he's saying.
They do.
That's what he's saying.
But not exactly like that. But I'm saying like they do that around the world, and it's actually not bad. The only thing is, the babies who drank from the same milk, they are now siblings. Yeah. Please.
My two aunts did it. One had milk and one didn't have. So the one who had milk breastfeed my cousin.
Yeah. Your mom breastfeed your cousin?
No, I have two aunts who did it. One of the aunts didn't have milk, and the other one had, and she fed the other baby.
I see.
My grandmother.
Yeah, they can't get married now.
That's all the babies don't get attached to the breastfeeding.
Yeah, because if you drink from the same milk, you're siblings. That's it. Yeah, don't drink the milk of somebody.
That's how you vote for the baby.
Yeah. Okay, so the nature of the microbiota initially colonizing large intestine is influenced by whether the baby received breast milk. So that's the formula milk is not as good. But you see now the moms. So you guys don't think it's a good idea to give your baby to another? Actually, biologically, is an excellent idea.
What if the mom
But
is not
you don't want to.
What if the other mom is not healthy? Like
Breast milk is okay. Breast milk is okay.
What
It's
if the
safe.
mom is
Breast milk has nothing to do with the rest of the body. That's something that is like a special thing, and it's breast milk is better than formula. Okay. It's okay. No problem. These are different ideas. But who knows? Maybe one day, God knows, the war breaks out. You don't know what Trump is going to do. And then you have no milk in your breast. And you look at somebody, can you breastfeed my child, please? It happens.
years ago.
Yeah.
And I think
There was a
there
milk
was no milk.
shortage, and people couldn't get milk for their babies.
Yeah.
So breastfeeding moms were giving free breast milk.
What if the breastfeeding mom was eating the pig? Oink oink. That's okay? Okay. Okay. Indigenous flora. So we have them, we already discussed them colonizing the gastrointestinal tract and the skin. So, what are the common, these are the common genera of the bacteria that infect the skin. Those are the Pseudomonas, the Micrococcus, and fungi. You just need to remember the Candida and the Malassezia. These are the most known common genera. And arthropods, there is these different types of mite. In the gastrointestinal tract, we have the Streptococcus, the Neisseria. Those are the main ones. Fungi, we have the Candida again. And protozoas are the Entamoeba gingivalis, which are found in the oral cavity. In the large intestine, these are different types of bacteria found in the large intestine and the rectal tract. So the point here is, are you connected to the outside world? Then you are a site where there's going to be a lot of policing, a lot of white blood cells, and a lot of bacteria that will colonize and on that region. It's very interesting. It's very interesting how portals of entry are full of both white blood cells to combat these microorganisms that are pathogenic, and the pathogenic microorganisms are still there. They didn't go away. In the urinary tract, those are the common bacteria that are found in the urinary tract. Also, your eye, exposed to air, ear. Okay, those are the different types of the bacteria that are found in these different locations. Okay, now when you look at the skin has the epidermis at the surface and has the dermis right below it. And below is the hypodermis that is full of the subcutaneous fat tissue. There are two cutaneous populations. There are transient bacteria. They cling to the surface, but they do not grow there. They're influenced by hygiene. So the more hygienic you are, the less these transient bacteria are going to attack you. But the resident, they are stable, they're predictable, they live there. They're less influenced by hygiene. It doesn't matter how you expose them to which type of hygiene. It doesn't affect them and the primary bacteria and the yeast. So some soaps are, what are the best bathroom soaps for hygiene? What's the company? Dettol.
That's all.
That's all.
You know about that's all.
It's in my country too.
No, definitely that's all.
Dettol. You think so?
Yeah.
What about Dove?
No.
Dove and Irish Spring.
Dial.
What about both?
Dial.
So the best one for micro, that would be an interesting topic. What is the name of the best hygienic supplies in the market to fight these transient microbial infections? We need to find out. Actually, this is important. Maybe we can write a paper on that. The GI tract is a long, hollow tube. Talked about that, bounded by mucus. So it's rich in the malt, mucosa-associated lymphoid tissue. The tube is exposed to the environment. There are variations in the flora distribution due to the shifting conditions. So depends on the acidity. So you know the bacteria, they survive on an optimal pH environment. They survive on a particular oxygen. Some bacteria are aerobic, obligate aerobe. We talked about that last time. And some of them are facultative aerobes. In the oral cavity, in the large intestine and rectum, they harbor appreciable amount of flora. In the mouth, the most diverse and unique flora of the body are found in your mouth, and they have numerous adaptive niches, communities like in the cheeks, the gingiva, the tongue, floor of the mouth, and the tooth enamel. The most common residents are the aerobic Streptococcus species. Aerobic Streptococcus species. So the microbiota of the large intestine, these are the bacterios and the Clostridium. These are the most famous. And many species provide useful byproducts to the host. So, for example, they participate and engage in the fermentation of the waste material in the feces, and that actually generates for us some important vitamins. Why are vitamins important? Because they're needed for the coenzymes. Vitamins are coenzymes. What are coenzymes? You guys remember coenzymes from A and B?
Coenzymes are organic and
They are definitely not organic.
coenzymes. Oh, the metal ions.
Yeah, they are inorganic, yeah. So what do they do?
Oh, so somebody teaching us.
Really? So inorganic molecules are able to, okay, so inorganic molecules are responsible for, they are a shuttle, electron shuttlers. So the enzyme will take the electron from the reactant to the product, but the coenzyme will shuttle, will transfer the electron from the first reaction into the next. For example, the airplane is like an enzyme, and the shuttle bus that take you from the airport, to your destination, that could be like a coenzyme. So the main reaction is done by the enzyme, but you don't jump off the airplane. You need like the one that carries you. So that's the coenzyme. So inhabitants of the respiratory tract. What are the main prototypical bacteria that is found in your respiratory tract? And when we say respiratory tract, we mean upper respiratory tract. So you have you have the oral streptococci. These are the first organisms to colonize. And in the nares, in the nasal entrance and the vestibule, you have the bacteria known as Staphylococcus aureus. Those are the bacteria that are found in the nose, in the nasal cavity, and in the mucous membranes of the nasopharynx. You have the Neisseria species. And in the tonsils and the lower pharynx, you have assorted streptococci and the Haemophilus, but there is no flora in your bronchi and the lungs, which makes a lot of sense. You don't want any bacteria in your lungs because that's going to go in the hemoglobin in the blood, and that's going to make your blood septic. You're going to have septic shock. Yes?
So it goes back staph. A staph infection, is that when it travels?
Yes, so staph infection is when you have this staphylococcus bacteria that is a normal resident microbe that is living in the nasal mucosa, and your immune system holds it in check. So an opportunity, they are now able to overwhelm your immune system, escape it, evade it, and then cause an opportunistic endogenous infection, and that's going to be called strep, like strep throat, all that kind of thing. Okay? Questions? Sites that harbor the microflora. In the females, in the vaginal tract and the outer opening of the urethra. In males, in the interior urethra. The normal flora is essential to the health of the humans. You see that word there? Essential. You know how important this word is? Now people don't pay attention to it. Essential. What does essential mean? Essential, like your essence, meaning that something is wrong with who you are. Like, for example, we call testosterone an essential hormone for men. We say estrogen is an essential hormone for women. So that's why these guys who go to the gym and they have no testosterone, they just have the big muscles, but they have no testosterone, you find that there's something wrong with the man essence. And when there is a severe drop in like postmenopausal women, you see that they have lost a great part of the essence of the woman, because there is a bone density and the voice change and the anatomy. Because when the woman was a girl before she becomes a woman, there's a lot of anatomical changes that happen because estrogen. That's the essence of the woman, is the estrogen. So now women go and do estrogen replacement therapy. And that estrogen replacement therapy for these Hollywood actresses who don't want to accept long age, old age, long age, old age. They don't want to accept old age, so they go and they get estrogen replacement therapy, and they see that actually they look in the mirror, they see a lot of improvement. Until what happens? Breast cancer, because estrogen is known to irritate and instigate an increase in the receptors that are on these herb receptors on the mammalian breast tissue, and that causes like hyperplasia, and to start the cell cycle to go awry, and this uncontrollable cell division. So and you can never really tell what's the red line, like where to stop, like how much is a safe dose for me when it comes to estrogen replacement therapy. It depends from one person to another, and you can never calculate it. So people keep on taking them until out of nowhere, breast cancer appear. So you have to stay away from that. Um, Probiotics, they introduce known microbes back in the body that are there to help you. The yogurt. Which yogurt has the best probiotics? Hmm? Chobani? Activia.
No.
Hmm? They put, so if you want to get probiotics, where do you go? Pills. No, some of them they come in yogurt. I think.
Yeah, but it's frozen too.
Okay, does anybody know of any yogurt rich in probiotics? Activia. Okay. All righty. So we're gonna have an Activia yogurt party. Okay. Severity of disease depends on the virulence of the pathogen. What is virulence? Virulence.
The word that taught us, it means the
Virulence is the resistance of the pathogenic microorganisms to treatment. It is gonna fight back and it's gonna try to survive and not die. Okay. Virulence factor is characteristic or structure that contributes to the ability of a microbe to cause disease. Portals of entry. So the characteristic route of a microbe follows to enter the tissue of the body. There are exogenous agents that originate from the source outside the body, and endogenous, we talked about that. They already exist in the human body. Okay. The infectious dose represents the minimum number of microbes required for an infection to proceed. So microbes with small infectious doses have a greater virulence. And the microbes with larger infection dosages, they have a greater virulence. So the number of the microbes below the infectious dose will not result in an infection. Now we move on to the next phase, attaching to the host. We have now entered to a portal of entry. Now we need to colonize and attach to the host. The first procedure is known as adhesion. All microorganisms have to go through this sequence. There has to be an adhesion, and microbes are going to gain a stable foothold at the portal of entry. That is depending on the binding between specific molecules between the host and the pathogen, to staple them together, the host and the pathogen. So bacteria have the fimbriae, the pili, the flagella, the capsules, the suckers, the hooks, and the barbs. All of those allow the different types of microorganisms that are pathogenic in order to attach to the and perform adhesion, because you need to adhere to the tissue that you want to infect. Okay, now we're talking about invading and becoming established. That's the third phase. So you have exoenzymes. Exoenzymes are enzymes that are secreted externally. That's why they call them exo. These are bacteria that produce extracellular enzymes that dissolve barriers and penetrate through or between the cells to invade the underlying tissues, to invade the underlying tissue. Toxins, primarily exotoxins, secreted by bacteria that damage the target cells, which die and begin to slough off. Block phagocytic response. They are encapsulated bacteria. They can escape phagocytosis and continue to grow and cause further infection. So invasion factors are Salmonella. They have a unique system to invade an intestinal cell, and after adhering to the cell's microvilli with its fimbriae, it injects proteins into the cell with a probe-like structure. So these proteins disrupt the actin filaments, and they cause the cell membrane to form a series of ruffles that surround the bacteria and pull it to the inside. Viruses operate in a similar fashion too. So, and this is one of the interesting things they found out about HIV, is that some people have a mutation, a genetic defect, where the hook that allows the HIV virus to bind to the host cell and then be internalized is absent. It's just a genetic defect. It wasn't supposed to be that way. All of us have it, have that hook for the HIV virus. But some people are born, that's why I tell students, not all mutations are bad. For example, people who are heterozygous carriers for a sickle cell anemia will never get malaria. So absolutely, most of mutations are harmful, but some of them are actually can help you survive something as dangerous as AIDS. Okay, hopefully you don't have to deal with that.
How would you know if you have that book?
You have to do, yeah, excellent. That's a good question. You have to do like a genetic testing, yeah, genetic testing. But they don't care about it because it's gonna be very hard for you to find it because they only care about services that will make money that most people won't. Now, if you want to do something like that, it's not going to be covered by insurance, and you don't even need to worry about it if you are not like the sexually promiscuous octopus with the whole world. You don't have to worry about that. You don't have to worry about this. You don't have to worry about HIV if you are like dealing with like.
That's not true.
Really? Yeah, you said that first lecture. Yeah, you're right. Maybe you're faithful and your partner is not. That one I can't help you with. I don't know.
Yeah,
You
that's
can't help
even
them.
worse. Like you're faithful,
Yeah.
your partner. Oh my God.
Yeah, it happens. It happens.
Your partner is an octopus.
Yeah, God help us. Okay, we talk about torch. Torch is toxoplasmosis, and there's other diseases like syphilis, varicella zoster, parvovirus, HIV, rubella, cytomegalovirus, and the herpes simplex virus. So the herpes simplex virus, there's two types, types 1 and 2. Type 1 is not that bad. Type 1 shouldn't even be called herpes. I don't know, these doctors sometimes make problems. The first one, everybody has it because it comes with air. It is not associated with the genitalia. It is not. But herpes type 2, that one is the most dangerous, devastating. So many people, unfortunately, have STI. In the United States, in every 4 women, one is suffering from STDs. How they call them STIs, sexually transmitted infection. It's really not a safe world out there. Yeah, yeah. If you like go on these websites, Tinder and dating, yeah, okay. One day you're gonna get hit by somebody. Be careful, don't be all those things. Yeah.
Same thing with the candida albicans is normal in the body, like the food. Or when it's the pH change in the body, they say that's when it comes to infection.
So it's not the pH. It's because you took a medication, like let's say somebody is suffering from like a hyperinflammation, like lupus. or somebody is suffering from a severe infection that there's like a hypersensitivity when your immune system is overtly active, like hyper working excessively. So you give them like asthma, for example. Asthma is a known case of hypersensitivity. Your immune system is over the top, taking things more than they're supposed to be, assuming that an allergen is like a microbe, infectious microbe, and it's not. So somebody like that, you give them a corticosteroid. What do corticosteroids do? They dampen, they make your immune system weak and sleepy. But the problem is if your immune system is weak and sleepy, if the cat is away, the mice will play. So that's the candida now appears because the immune system used to shut it down. Now you're taking a medication to lower your immune system, and that's a problem. It arises again. Questions? Okay, origins and the effects of the exotoxins and the endotoxin. The target organs are damaged. Obviously, the exotoxins and endotoxins both are toxins. Both are negative, harmful substances. Endotoxins and exotoxins are different. So the target organs are damaged. You see, and the heart, the muscle, the blood cells, the intestinal tract is going to show dysfunction. And there's a general physiological effect like a fever, malaise, aches, and shock. There are four distinct stages of clinical infection. You have the incubation period. So when an infection begins clinically, you go through four. That's it. Infection inducing inflammation. Remember, every infection leads to inflammation. But does every inflammation caused by infection? No. Like, for example, I tell my students, you go to the clinic and you find 5 people come into the clinic coughing. You say that they're all sick with cough. Cough is not a sickness. Cough is a sign. What is coughing is a symptom because cough could be because of asthma, cough could be because of pneumonia, cough could be because of lung fibrosis, cough could be because of lung cancer, God forbid. So there's different causes for this inflammation. Now, if you examine the infection will lead to inflammation. Asthma, is asthma an inflammation?
No.
Absolutely, it's an inflammation. Because no. Inflame is not like if they call it inflame, it's like from flame, fire. So there's redness, heat, pain, swelling. Whenever you feel redness, heat, pain, swelling, that's inflammation. If you slap your own wrist and it becomes red, that's inflammation. So now you damage the tissue. The tissue has been damaged by different ways. By infection is when the bacteria is causing the redness, heat, pain. But there is other things that cause redness, heat, pain. Like when you spill Clorox on your hands, it becomes red and you have inflammation now. But was that because of the infection? No, that's the inflammation because of a chemical agent. Sometimes the weather is so cold out, like last week, so people's faces are red because the hypothermia, the cold, is hitting the skin, damaging the skin cell. You have redness, pain, swelling, heat, loss of fun. So that's a hypothermia. That's an example of an infection caused by hypothermia. Sometimes you have like a trauma. You fell, you twisted your ankle, you got a bruise on your face. So that one has nothing to do with bacteria. There's a trauma that caused inflammation. There's many different causes for inflammation. One of them is infection. So they're not the same. Every infection leads to inflammation. Every infection causes inflammation, but not every inflammation is caused by infection. There is sometimes, what about your rheumatoid arthritis? When your own immune system is attacking your knee joints. Is that inflammation? Yes, because listen, if you want to tell if there's an inflammation or not, think about is there tissue damage, if there's redness, pain, swelling, heat, then that's an inflammation. Is cancer is cancer an inflammation disease?
No.
No, because cancer here is not caused by, it's like a that necrosis. Whenever there's necrosis, there's inflammation. Does cancer eventually lead to inflammation?
Yeah.
Absolutely. So when a cancer cell is metastatic and malignant and moves through the body and lodges off and binds to another different type of tissue, clear? Yeah. So sometimes a cancer can lead to inflammation, but cancer is not an inflammatory disease. It's genetic disease.
Is that when the NK doesn't work?
The natural killer cells, those are types of your B lymphocytes that act in a natural immunity. So they fight to, their job is to look for cancer cells, but sometimes the cancer cells are so malignant that they overwhelm the natural killer cells. Yeah, so that also leads to inflammation. Prodromal phase is the phase where there are vague feelings or discomfort and non-specific complaints. Then you have the invasion, where there's a multiplication of high levels and it becomes well established and more specific signs and symptoms. The convalescent period, as the person begins to respond to the infection, the symptoms are going to decline. So you see here, as the time goes on the x-axis, on the y-axis, you have your intensity of the symptoms. So the first phase in the sequence, in the sequela, is into incubation. So it is huddling and remaining in your body. Then the prodromal stage, you have an increase in the intensity of the symptoms. And then the worst phase, where there is an increase in the symptoms, that's going to be the height of the infection. So this is the period of the infection. Then you have the convalescent period where the infection phase would end and you're going back to the treatment. Yeah.
Let's say during COVID time, right? And it would be like 2 weeks, like 14 days. The person is like, approach someone that has COVID, but yet it takes 14 days for you to have acceptance or to be sick. Would that be considered as incubation?
If you, I don't get it. Can you say it again?
During COVID time, they said that once you once you approach somebody, right, you approach someone, right, and then this person spit on your face, you don't automatically have the COVID yet. But yet,
oh,
the
quarantine. You're talking about the quarantine.
It takes like
yeah,
14 days
I
for
see.
them to show it to you.
I went through that.
Incubation?
Absolutely, you got it. Absolutely. Actually, you reminded me of the COVID. Yeah, actually, that's true. The quarantine phase is actually, they should have called the incubation phase. That's the 14 days on which you would have the colonization of the virus, and the virus is going through the prodromal stage. And then after that, if there's any height of infection, it would take place during that period. Afterward, then absolutely, you're not going to be able to transmit. It may still remain in your body, but you're not going to be able to transmit. Your immune system has settled it. Okay, you guys got the injection?
I didn't get it until after
Not the infection,
No,
the vaccination. Raise your hand if you had COVID at any point.
after I got
Raise your hand if you never had it. Wow, interesting. Very good. You're like my brother. My brother never had it, and he was against it. At the time I was in medical school, they said if you get the vaccination, we'll give you $100, and I wanted to go to the gym. And they wouldn't let you in the gym without a vaccination. So I went and I got the vaccination so I can go to the gym. That's why I got it. That's the only reason I got it.
Do you go to the gym now?
I'm too tired now. I wasn't a professor then.
You don't get you got the vaccine.
Yeah, I got
You got
Pfizer. Only one. The one when they pay you. And that's it.
No, they did. I got one, and then like when I had to get the next one, then that's what they told me at my job. Oh, it's not required. First they were trying to take us out, like oh, you can't come to work, and then that same day I ran to get it. The email was like, oh, you guys don't need to get it. I was so tired.
I was out the country. I was gone. I wasn't even here. No. And I was out there. I was out of my country. Yeah, it was tough times. It was very tough. You guys got a check from the government. I was like, I wish I was there. I didn't get it. I wasn't here. Didn't they give like a check?
No.
You do get money. When you stay home.
Yes. Yes.
Well, if you stay from your job, they pay you. They only pay you 5 days. Because you got
Okay.
sick at work.
Oh boy. Okay. Alrighty. So there are localized infections, systemic infections. Localized meaning that they are localized to a particular tissue or organ. Systemic, that's the most dangerous, but it spreads to the rest of the body. So according to the sequence of occurrence, you have a primary infection, that's the initial infection. Secondary infections when there is subsequent infection by a different microbe. So the acute infection comes on rapidly. We talked about that. And chronic infection is going to persist for a long time. Which one is going to lead to septic shock if you don't get it treated? Yeah, that's the septic shock is caused by acute or chronic infection. Chronic, because chronic takes a long time. So your blood vessels are hyperdilated. The sequence is acute, then chronic, then septic. You don't jump from acute to septic shock.
So, chronic inflammation. I mean, septic shock is considered chronic.
No, septic shock is caused by chronic inflammation. Septic shock means that there's a shock, a hypotensive shock. So the blood pressure drops severely, leading to the death. Okay?
Patient with septic must be treated right away.
Absolutely. If you don't treat septic shock, that means the blood vessels are going to vasodilate, and then the blood pressure drop. Yeah, and then you're going to. So sepsis did you say sepsis or septic shock? Sepsis? Oh yeah, so sepsis is when there is an infection, intoxication of your blood with the pathogenic bacteria. And then if it lingers on and on, that's going to lead to a shock that is caused by the sepsis, so they call it septic shock. Yeah, that's the death, yeah. Okay. So the signs and symptoms of a disease. So the sign is the fever. The symptom is the chills. So signs are representing objective evidence of a disease as noted by the observer. So that's why like a traffic sign, you see it, so you observe it. So, and then the symptom is subjective evidence of a disease as sensed by the patient. So the symptom, the patient is going to say to you. So for example, symptom, the patient tells you I have a chill, but you detect that there is a fever. The symptom, the patient tells you I have pain, pain is not a sign for you. Unless the patient is like irritated or groaning, something like that, then you can tell. So the sign is something you can detect, you can diagnose, you can see it. But the symptom, it has to be told to you by the patient. Leukocytes. Leukocytosis is a sign, and itching is the actual symptom. So always we detect both the signs, the observable signs, and we speak to the patient so they can tell us. No, it's not subjective. Yeah, it is subjective in the sense that the patient is the one who's telling you how they based on their feelings. But that is actually very conclusive evidence to make a diagnosis. Because I know some diseases come with certain particular types of symptoms, okay, that are known. So some syndrome will come, you know that the patient will have the particular types of symptoms that they have to reveal to you. So you add your signs that you can observe when you perform a physical examination. You perform a physical examination on the patient, and then it's both. Absolutely. Okay. Pathogens depart by a specific venue, greatly influenced by the dissemination of the infection. And respiratory, so for example, portals of entry are respiratory and salivary portals. Epithelial cells are like your skin and your scalp, the fecal oral route, the urogenital tract, and also removal of blood or the bleeding. So the persistence of the microbes and the pathogenic conditions. There's an apparent recovery of the host. If there is no recovery of the host, that's going to cause a latent phase. So after the initial symptoms in a certain chronic disease, the microbe can periodically become active and produce a recurrent disease. So the person may or may not shed it during the latent stage. So that means the pathogenic microbe is still remaining in the tissue, but is not showing signs yet. The chronic carrier is a person with a latent infection who sheds the infectious agent. So now that's dangerous because you're able to transfer and spread the infection to somebody else. A sequela is a long-term or permanent damage to the tissue of the organs. So what are the origins and the transmission patterns of the microbe? So that's important in the field of epidemiology. Epidemiology is the study of the frequency and distribution of disease and other health-related factors in a defined human population. It involves many disciplines, not only microbiology, but also anatomy, physiology, immunology, medicine, and it considers many diseases other than the infectious ones. Reservoir. So in the reservoir, you have primary habitat of a pathogen in the natural world, and you have human or animal carriers, soil, or they're also found in water and in plants. And the sources, you have individual or an object from which an infection is acquired. So the source could be another person. The source could be another person. The source could be bacteria that came from it could be something, a surface on which it colonized. Living reservoirs. So you have carriers. These are individuals who inconspicuously, so it's not clear, they hide it, inconspicuously shelter a pathogen and spread it to others. So those are asymptomatic carriers and they show no symptoms. Passive carriers are contaminated healthcare providers. They transfer them to other patients. Incubation carriers, they spread the infectious agent during the incubation period. Convalescent carriers, they are recuperating without symptoms, and chronic carriers, they are individuals that shelter the infectious agent for a long time. Okay, a vector is a living animal other than a human that transmits an infectious agent from one host to another. There are biological vectors. These are actively participating in the pathogen's life cycle, meaning that the pathogen is going to die unless it lives a phase inside that particular animal. You know, some microorganisms are like that. There are mechanical vectors. These are not necessary to the life cycle of an infectious agent, and they just transport it without being infected. So the majority of the vectors happen to be arthropods, like fleas, mosquitoes, flies, and ticks, and some larger animals can also spread the infection, like mammals, birds, and lower vertebrates. What is zoonosis? Zoonosis is an infection indigenous to the animals that are naturally transmissible to humans, like a dead-end host. So at least 150 zoonoses exist, and they're impossible to eradicate the disease without eradicating the animal reservoir. So some animals, the infection is indigenous to animals, naturally transmissible to humans. Some animals are known to be a reservoir of infectious pathogenic microbes. Who do you think would be a perfect example? Oink, oink, oink. Okay, next
Wait a
one.
minute. Not too long ago, a couple of years back, about I think like we had mad cow. Would that be?
Mad cow, no.
Mad cow.
Mad cow disease is not a microbial disease. What's going on? What's going on? What's going on? Are you guys paying attention to your classmate?
No, we was talking about what you were saying about the ointment. You said like you had to start the report from being inside.
Okay, that's up to you. I'm not campaigning for it. It's up to you. I'm just telling you the knowledge. Your classmate said something very interesting. What is mad cow disease? Is that a microbial infection? What is mad cow disease? So the cow dies or becomes mad. But it's not really, I don't know why they call it mad, because the cow doesn't become aggressive, mad, or something. I don't know why they call it that. But what happens is there is a encephalopathy, so it's a brain disease. Number one, mad cow disease is a disease in the brain in which there is a lot of misfolded proteins. So proteins, the law is proteins do not operate until they fold. They fold from a primary structure to secondary structure to tertiary structure to quaternary structure. Now, this property of folding usually is very successful. However, when we get older, it's not as excellent. So our body will fail to fold the proteins properly. Even when we're young, your body can sometimes make a mistake folding these proteins. But that's a no problem because there's an organelle inside the cell known as the protein shredder. It shreds and destroys and chops up all the misfolded proteins, all the improperly folded proteins, all the damaged proteins. We shred them and they are no longer harmful. They become harmless blebs. But there has to be a balance. Those shredders are so many. If your body now is developing severe amount of misfolded proteins, more than the capacity of the shredders, what's the name of the organelle in your cell that is known as a shredder of proteins that are misfolded? Prion? No, the prion are the misfolded damaged proteins. You're right. The name of the one that is supposed to shred them. Yeah, you're almost there. I'm sorry? No, the Golgi apparatus is a pita bread that is responsible for packaging and putting like boxing and putting all the proteins and packaging them to be exported out. That's known as the proteasome. It's a shredder. It shreds all the proteins that are improperly folded, that are damaged. So it shreds them and it removes them. However, in those diseases, especially for people who are cocaine users, substance abuse and drug dependence, like heroin and cocaine, they die from that. How? Because heroin and cocaine, they do two things. They destroy your bodily systems that are responsible for properly folding the proteins. So now those people, the proteins in their body are not going to be folded properly. Number two, cocaine and heroin, they destroy the proteasome, the shredder of misfolded protein. So now the amount of misfolded, damaged, defective proteins in their brain is so excessive, they will have mad cow disease. But they don't call it mad cow disease, they call it Creutzfeldt disease. So that is not micro.
We talk about that, right?
Yeah.
And it messed up your nerve, right? No?
Yeah, it messed up your brain, all the nerves in the brain, it damages them. And most of the patients who were drug abuse or drug dependence and substance abuse, especially with cocaine and heroin, they died from that.
But
Like a long time. Some people live
I don't know.
but Professor, but it's plasmosis, right?
Mhm.
So this plasmosis has chicken pox. So that's bacteria.
Yeah, so toxoplasmosis is a type of bacteria. Also in cats. So sometimes your pets, you have a pet that has like the dogs, especially dogs have a lot of they're like a reservoir for many different types of very dangerous pathogens. Like the dog is for like a protection from the thief, it's a protection or for like hunting. But if you're like hugging the dog, you're kissing the dog in the mouth, then you have a lot of very dangerous bacteria that's gonna come inside. Yeah, they do that. You know people they don't know, and then they these are the most virulent types of bacteria. Yeah. It happens, yeah, yeah. And they don't clean after their pets, so they leave their stuff around in front of your house. Okay. Alrighty. So communicable diseases. When an infected host can transmit the infection agent to another host and establish an infection. So non-communicable diseases or infectious diseases does not arise through the transmission from host to host. But there's like a middle delivery. So occurs primarily when a compromised person is invaded by his or her own microbiota. That's like an opportunistic parasite. And there's a contact with organism in the natural or the non-living reservoir. Direct contact, when there's a physical contact or there's fine aerosol droplets. So I see some of you when you come to class, you clean the surfaces. That's actually excellent because now you have removed all potential aerosol droplets. And sometimes another pattern of transmission would be the indirect contact, or it passes from infected host to intermediate conveyor and then to another host. The vehicle is an inanimate material. Vehicle is like a transfer is a vehicle of, yeah, so it transfer it, but it's an Uber of disease, of bacteria, water, biological products, and fomites. Airborne, so droplet nuclei and aerosols, those are also examples of, carriers that would transmit the disease. So how communicable infection diseases are acquired? They are acquired indirectly through the transmission of the vehicles or by direct transmission. So you have like malaria. Malaria is a perfect example of a direct transmission where you have you have the mosquito, and you know that the mosquito itself is not the actual one carrying the bacteria. It's another parasite who lives in the intestine of the mosquito. No, it's not a pregnant mosquito. It's a parasite that colonized the intestine of the mosquito. So when the mosquito puts its straw through your skin to suck up your blood, now that terrible, atrocious parasite who lives in the intestine is going to be able to leak, and now it's going to enter your body.
It's a specialized mosquito. It's not any mosquito.
It's an infected mosquito. The mosquito, not all mosquitoes. Yeah, not all mosquitoes. Only a mosquito, and the mosquito itself is suffering. The mosquito itself is sick. And now it transfers the disease to you. Okay.
Does
So
the mosquito feel bad? I'm sorry. Does it die when it does that to you, or does it's for them to feel better? Like when they transmit it, are they like trying to the disease?
So the mosquito is not intending to transfer the parasite to you. The mosquito is trying to suck up your blood because they live off your blood. While that's happening, there is an accidental transfer and transmission of that parasite who is in the intestine of the mosquito. Then it goes inside your body. So the mosquito has nothing to do with malaria. It's just a middle ground, and it transfers it. It's just the mosquito itself is like suffering from that particular parasite. So surveillance is collecting, analyzing, and reporting the data on rates of occurrence, mortality, morbidity, and transmission of infection. Frequency of cases. The prevalence, which is the total number of existing cases with respect to the entire population, usually represented by a percentage of the population. The prevalence of the normal total number of existing cases with respect to the entire population. How many people have the disease, for example, COVID, compared to the whole prevalence, the prevalence. Incidence measures the number of new cases over a certain period of time as compared with the general healthy population. Students have a problem remembering the difference between prevalence and incidence, the difference between precedence and incidence. So prevalence and incidence are different in the sense that prevalence, you stop the time now and you look at up to this point how many people have the disease. Incidence is you look from now and all onward in the future. Prevalence is like a past, present thing. How many diseases got sick in the past and how many are still sick. But I mean past, like who are suffering in our population. But incidence is from starting off now. How many people are going to get the disease now? That's incidence. More and moving on. Mortality rate is by a time until the study is over. So it's going to be a 3-month incidence rate, a year incidence rate, a weekly incidence rate. So the mortality rate is the total number of deaths in a population due to a certain disease. Morbidity is the number of people afflicted with a certain disease. So morbidity, how many are sick? Mortality, how many couldn't make it? So that's the prevalence of COVID-19 by each state. An endemic occurrence represents a disease that exhibits a relatively steady frequency over a long period of time in a particular geographic location. And sporadic occurrence represents when occasional cases are reported at irregular intervals. Pandemic occurrence is when it becomes cross-continental. There is epidemic cross-continent, and the epidemic occurrence is when the prevalence of a disease is increasing beyond what is expected in that particular area. Nosocomial infections, that is an infection that is taken from the hospital. You know, it's very dangerous working in hospitals. Why? Because they keep sterilizing the hospital and they kill a lot of infectious microorganisms, but like a 10% survive. This 10% now is going to multiply, and then when you use a different mechanism to eradicate them, they will die, but some will remain. So the more you clean, the more you end up with a very resistant and virulent type of bacteria. So if you get infected with a nosocomial infection, it's very hard to treat because that is the best of the best who survive all types and develop like resistance. So the nosocomial infections are called the healthcare associated infections, are diseases that are acquired or developed during a hospital stay. And that is caused by surgical procedures, equipment, or maybe the personnel, and due to exposure to drug-resistant microorganisms. The most common.
Is it because, okay, now that what you're saying, I'm trying to put together. When someone has an infection from the hospital, and then they give them antibiotics, yet that antibiotics doesn't work. They give him another antibiotic.
Yeah.
So now they give resistance to the antibiotic and give him like a different type of infection. That's what's going on.
So what's happening here is that it explains the cause of the resistance. The cause of the resistance is you're dealing with a type of infectious microorganism, not always bacteria, but bacteria mostly, is because the hospital is trying to make it as safe as possible. So they use different types of eradication mechanisms. Bacteria does die, but it's never going to become like the wound or like your blood. It's not going to become sterile. No hospital will ever become sterile because the bacteria will undergo a mutation, a genetic mutation that gives us the capacity and the resistance to overcome the disease process. So now when you give antibiotic, it's very hard to treat. That's what it's saying. So, but now they're trying to develop like antibiotics that are even hard. So there's a war between like pharmaceuticals and the infectious microbes. So they try to find out which is the genetic mutation they want to work around to make medications. So what you need to know is that these what are the bacteria that are known to be the cause of a nosocomial infection? And these are the gram-negative intestinal flora. These are the Escherichia coli, Klebsiella, the Pseudomonas. The gram-positive bacteria, these are the Staphylococcus and the Streptococci and the yeast. And true pathogens such as the tubercle bacillus, the Salmonella, the hepatitis B, and the influenza virus. That shows us the prevalence of nosocomial infection. So nosocomial infections usually target the respiratory tract of 22%. And the least that gets infected with a nosocomial infection is your blood. So that's something to know. You absolutely don't need to memorize all these different types of bacteria, but the respiratory tract is you just need to know that what are the biggest and the smallest. The biggest victim or the biggest organ system that is harmed by your nosocomial infection, those are the respiratory tract, and the one that is least harmed, this is the blood system. There are universal blood and body fluid precautions. These are stringent measures to prevent the spread of the nosocomial infections from patient to patient or from patient to worker, and that is based on the assumption that all patient specimens could harbor infectious agents. If the prevention is not possible, they include techniques to take purposeful measures in order to decontaminate the potentially infectious material. Any questions? Okay. Please take 15 minutes.